Hello everyone, I am Dr. Nupur, and today in this video I am going to tell you about the anatomy of the skull. This video shows only the basic anatomy of the skull, and after that in the coming videos we'll be understanding the skull from different aspects or different views, which bones are present in which view. So basically the skull is divided into two main portions. First is the upper portion, which is called as the cranium, and that encloses the brain inside it. So it forms a protective barrier or a protective shield for the delicate brain. And the second or the lower portion is the facial structure. All the facial bones, it comes under the facial structure. It provides a framework and support for the entire face. Based on these two structures, the skull is divided into two major parts. First is the neurocranium and second is the viscerocranium. So neurocranium involves the calvaria or the brain box, which is the basically the upper portion of the skull, and second the skull base that also comes under the neurocranium. So in the calvaria or brain box, there are the brain box is formed. There are 8 bones that encase and protect the brain. So in the calvaria or the upper portion of the skull, that is the brain box, and the base of the skull, both of them are formed by major 8 bones. First is the frontal bone, which is a single bone. This is the frontal bone. Then second is the parietal bone. Parietal bone is basically these are paired bones which are present on each side. Then the temporal bone. Temporal bone is also a paired bone. This pink structure is temporal bone. It is also present on both the sides. Then occipital bone. Occipital bone is a single bone. So this is not paired or unpaired bone. And sphenoid bone. This is also a single bone, and ethmoid bone. So there are 4 bones which are unpaired. These are frontal bone, occipital bone, sphenoidal and ethmoidal bone, and 2 bones which are paired, that is the parietal bone and the temporal bone. Calvaria or brain box or the skull cap, it is formed by frontal bone, the parietal bones, the occipital bone. That is the protective dome. It is formed by these 3 bones. Then the skull base is formed by sphenoid bone, the temporal bones, and the ethmoid bone, and some portion of the occipital bone. That provides the base of the skull or the sturdy foundation. Now coming to viscerocranium. Viscerocranium is basically the facial structure. So facial structure is formed by 14 bones that forms the facial skeleton, out of which 6 bones are paired bones. These are the nasal, the lacrimal, inferior nasal concha, maxillary, maxilla bone, and zygomatic and palatine bone, and 2 bones which are unpaired, that is mandible and vomer. So the paired bones are maxilla. These yellow bones, these are the maxillary bones. Then zygomatic, this is the zygomatic bone. Both of these bones form the major facial structure. After that, there are smaller bones which are present. First is the nasal bone. So this is the nasal bone. This is also a paired bone. Then lacrimal bone. Towards the medial canthus, there are paired lacrimal bones. Inferior nasal conchae, they are present in the lowermost portion of the nasal structure. Then there is these palatine bones. So basically palatine bones, they form the roof of the oral cavity, but as the skull is the maxilla and mandible are joined together, so we cannot see the palatal bone, but it is clearly visible from inside of the mouth. Here we can see it in the nasal aperture, that is the palatine bones, that is posterior to the vomer bone. And then there are palatine and zygomatic, and after that there is a single bone which is present in the nasal skeleton, that is the vomer bone. So these are the nasal bones, 2 lacrimal bones, 2 inferior nasal conchae, 2 palatine bones, 1 vomer bone, 2 zygomatic bones, and 2 maxillary bones, and 1 single mandible. Mandible is a single structure, that is not a paired bone. So this is also a major part of the facial skeleton. So these 14 bones, they join together to form the viscerocranium. Now, the bones of the skull, they are basically joined by sutures. Sutures are fibrous joints and they do not allow the movement of these bones. Okay, so we can see here that the this is the suture which is present between parietal and temporal bone. This is the suture which is present between parietal and temporal bone. Then this is the suture which is present between parietal and occipital bone, which is called as lambdoid suture. Then coming to this suture, this is the coronal suture which is present between the frontal and the parietal bone. And between the parietal and temporal bone, this is the squamous suture. And between two parietal bones, or there is in the midline, there is a suture which is called as sagittal suture. So these are the fibrous joints. They do not provide any movement to these bones. In children, these joints can provide a slight movement. If there is increased intracranial pressure, then these sutures can fall apart and they can open. But as the adults, in the adults, these sutures completely close and these bones start fusing. At the age of 30 to 40 years, these bones, they start fusing from the inside of the skull or the inner surface of the skull. And in the patient or the persons who are aged between 40 to 50 years, these sutures, they start to join, or these bones, they start to fuse from the outer surface of the skull. So basically, as the age grows, these sutures, they are completely closed, or these bones are completely intermingled, and they do not have any kind of movement along this suture. In skull, there is only one joint which can provide movement to bones, that is the temporomandibular joint. This joint provides movement to the mandible. That is gangliomo-diarthroidal joint, so that provides movement in two planes. So only the temporomandibular joint is the kind of joint which provides movement. Otherwise, all the joints of the skull, they do not give any kind of movement to these bones. Now, if we see the calvaria or the skull cap from beneath, there are basically it is divided into three portions. First is the anterior cranial fossa. So this portion is the anterior cranial fossa. It is formed by frontal bone. This blue colored is the frontal bone. Then the frontal bone, and it houses it is formed by frontal bone, then ethmoid bone. This middle portion is the ethmoid bone, and a portion of sphenoid bone. So these three bones, they together join to form the anterior cranial fossa. The frontal lobes of the brain are lodged within this anterior cranial fossa. Then comes the middle cranial fossa. This dotted line or butterfly shaped structure, it is the middle cranial fossa. It is formed by again the portion of the sphenoidal bone and both temporal bones on both the sides. So this middle cranial fossa, it accommodates the temporal lobes of the brain. And lastly, there is posterior cranial fossa. So it contains the cerebellum and brain stem, and it is formed by the portion of the temporal bones and occipital bone. This is the occipital bone. So there are three major portions of the calvaria, that is the anterior cranial fossa, the middle cranial fossa, and the posterior cranial fossa. Each fossa features essential foramina. There are few foraminas like this foramen magnum. These foramina allow the passages of cranial nerves and blood vessels and few important structures from brain to spinal cord. Coming to embryology of the skull, so basically we can again divide the skull embryology into two parts. First is the embryology of viscerocranium or development of this neurocranium, and second is the development of viscerocranium. Neurocranium, it develops again by two distinct methods. First is the intramembranous ossification and second is the intracartilaginous ossification. Skull cap or calvaria, the upper portion of the skull. This skull cap, it contains the frontal bone, the parietal bones and the occipital bone. All these bones, they ossify by intramembranous ossification. So and the the skull cap is formed by intramembranous ossification. There are two major cell groups or tissues which are present for embryology of the skull, or which are helpful in the development of the skulls. First is the neural crest cells, and second is the paraxial mesoderm. So these three bones, they develop from the intramembranous ossification of neural crest cells and paraxial mesoderm. Coming to skull base. The skull base, it forms from cartilage, that is the endochondral ossification, and it is also called as chondrocranium or cartilaginous neurocranium. So again, neural crest cells and paraxial mesoderm, these two cells take part in the development of the skull, but within these two cells there is endochondral ossification, which gives the development of which gives the formation of skull base. So the bones of the skull base, they ossify by endochondral ossification, and the skull cap, it ossifies by intramembranous ossification. Again, viscerocranium again is formed by these two major processes only. First is the intramembranous ossification, and second is the endochondral ossification. Both these endochondral and intramembranous ossification occur in the cells from first and second pharyngeal arches. So from the first pharyngeal arch, there is development of maxillary processes, maxillary prominence, and the mandibular prominence. Both these, they develop by both intramembranous and endochondral ossification. Then the major sutures which are present in the skull are the coronal suture. This is the coronal suture, which is present between the frontal bone and the two parietal bones. Then second is the sagittal suture. Sagittal suture is present somewhere over here, which is present between the two parietal bones. Then lambdoid suture, which is present between the parietal bone and occipital bone, and squamous suture, which is present between the temporal bone and parietal bone. These are the major sutures of the skull. Then fontanelles. Fontanelles are basically the junction of these sutures. Like this, there is this anterior fontanelle. This diamond shaped portion is the anterior fontanelle. It is basically soft spot which is present in the infants, and they are crucial membranous gaps that allow the skull to expand rapidly for brain growth, and also enable passage through the birth canal. So this is the anterior fontanelle, which is present at the junction of coronal suture and sagittal suture. Here is the sagittal suture. So this is the anterior fontanelle. It is a soft spot present between the frontal and the parietal bones. Second is the posterior fontanelle. This anterior fontanelle is also called as bregma, and this posterior fontanelle, which is present at the junction of sagittal suture and lambdoid suture, is called as lambda. This anterior fontanelle is called as bregma, and this posterior fontanelle is called as lambda. Both this posterior fontanelle, it gets ossified after 1 to 2 months after birth, and the anterior fontanelle, it takes almost 4 to 26 weeks or 26 months for the ossification of this fontanelle. So coming to summary of this video, we can say that skull is the major function of the skull is it provides intricate protection. It provides protection, support, and flexibility to the bones of skull and facial bones. Then it is a multi-bone structure. It is composed of multiple bones which are joined together by the fibrous joints which do not allow the movement of the bones, that are called as sutures, and there are multiple foramina from which very important nerves and vessels pass through. And so coming to the end of the presentation or end of the lecture, this was only the introduction of the anatomy of the skull, and in coming videos we'll see the skull anatomy in detail. Thank you so much.